Now we have taken all the measures to be able to assure and to give patients the most safety environment that they can have. So it's much safer to come to clinic or to the OR than going to the grocery store or going to a mall. Just because we know that we have the social distancing, everybody's using masks. We know that everybody gets screened for temperature and for symptoms. So if there's anywhere that would be safe to go in these times is probably COVID. More even so, COVID times, more even so, the fact that most people are working from home will allow those people to actually recover at home. So it's, before they used to ask us what's the perfect time for surgery, and there never was, but probably now there is, right? If you're working from home and you need to recover, there's nothing more comfortable than recovering from a surgery from home. So I think it's a safe environment to come to clinic. I think it's the safest environment to have surgery just because the OR is completely protected. Everybody gets tested for COVID before going to surgery, and recovering now is as comfortable as it can be from home. So we're a very research-driven practice. We like to understand what our patients feel, what our patients' expectations are, and how they get back and how, and at which rate. And I think it's important to just understand from a research perspective, what are we, instructing patients or telling patients that they should expect after surgery, and that's why research is so important. We've done a fair amount of research for golfers and how they get back after different type of procedures, such as rotator cuff tears, hip surgery, meniscus surgery, cartilage surgery. So those people can get back in an 89, to 94% of the cases to the same level that they were before. So we can actually tell our patients, it's really likely that you will go back to playing golf at the same level that you were before after you complete your physical therapy. The failure rates for conventional or traditional techniques were a little bit higher to what we have right now with new improved technologies. So I would encourage those patients that had nagging pain or had issues for a while, that were scared about what their neighbor told them, that now the technology has evolved and the techniques has evolved to a point that we can reliably get those patients back to golfing or any other activities. So in this room, basically two things happen. One, we have a really close communication with our physical therapists because we like our people or our patients to come here and attempt everything possible to try to avoid surgery. And that means that they will work with them in strengthening, stretching exercises. They will basically instruct them on how to do all those stretches before they start to play. They will teach them how to stay away from injuries. Now, in the event that they need to have surgery, they come here after, and that will be for 2 to 3 times a week for 3 to 6 months, depending on what type of procedures they had done. And it's pretty cool because we have all the latest and cutting-edge technology to be able to help them get back, such as having a walker or a treadmill that doesn't have gravity, to, for example, measuring or estimating the biomechanics of the body with sensors that can be put in the body and doing a swing or doing a baseball swing or just running or landing, and telling them exactly what's wrong with them. For example, if the core is weak or the motion of the ankle is weak besides, or regardless of the fact that the injury might be in the hip, we know that there might be other things in the biomechanics of that person that will not allow them to progress if they don't correct everything leading to that. As we said before, the golf swing, for example, takes all the force from the ground going to the knee, the hip, the shoulder, and then the club, which means that everything can be involved, and sometimes one thing that might be wrong might affect another joint. So it's important to address everything at once in a holistic way to try to get those people back to what they love to do.